A hearty good afternoon to everyone, and welcome to our session on the topic of small for gestational age in newborns. We are pleased to have Dr. Mamatha among us to educate us on this topic and shed some light over the causes and effects and help us with insights into this topic. Doctor, you have the stage.
Yeah, thank you very much for the introduction and thanks for giving me the opportunity to speak about today topic small for gestation age and welcome all. So pregnancy in anybody women life is a happy event and they wanted to have a smooth course throughout the pregnancy and they want to give a birth for an appropriate for age gestation baby and a normal healthy baby, but due to some unexpected complications in a pregnancy and there can be growth retardation of a fetus inside the mother's womb, which can result in a small for gestation baby or intrauterine growth retardation. So, come to the topic, what is SGA? Small for gestation age, it refers to the term for a babies who born at weight which is smaller than usual for a normal age for that gestation age, and their weight will be usually less than 10 centile for a corresponding gestational age. At birth these babies they appear small, overall they look small, and they can have a loose skin folds, and they have a very little subcutaneous tissue, and skin can be there can be peeling because of the less amniotic fluid inside the mother's womb because of growth retardation, and there can be a meconium staining of skin also, say, which is a complication of these SGA babies. And these SGA babies, and one more terminology is called as a intrauterine growth retardation. IUGR, it refers to like there is a decrease in velocity of the growth of fetus, which is recorded at least 2 times with the ultrasonographic measurement when the fetal anthropometry has been done. And so when the baby is born, it can be symmetrical IUGR or asymmetrical IUGR babies. In symmetrical IUGR babies, overall baby weight also less, and length also will be less, and head circumference also will be less than usual for expected for that corresponding gestational age. And in asymmetric IUGR babies, so only the weight will be less, but these babies they would have maintained a normal length and the head circumference. And why does SGA babies happens? What are all the factors? So, for a growth of a fetus in a mother's womb, baby fetus has to receive a good supply of nutrients and oxygen for growth. When there is a decreased supply of these nutrients and oxygen to fetus, baby can born with a small for weight, and there can be IUGR also. What are all the different factors which leads to these growth retardation of a babies? And it's been divided into the maternal factors, so any maternal problems, and other one is any placental abnormalities, and other there can be intrinsic fetal problem itself. These babies can have a low birth weight. Coming to the maternal factors, so what are all the factors so which leads to decreased supply of nutrients and oxygen to the growing fetus? So if the mother is chronic malnutrition, then if the mother is having anemia, or if mother is having pregnancy induced hypertension during the pregnancy, or so diabetic mellitus if they have during a pregnancy, and if mother catches any infection during the pregnancy, this also can lead to the growth retardation of a baby. And coming to the any habits like chronic smoking and alcoholism also results in a retardation in the growth of a fetus. And coming to the placenta, so which is the main organ which supply the blood and nutrients from a mother's, which carries from mother to the fetus, which is very important. If there is any abnormal placentation like placenta previa, or if there is any small bleeding, hematomas in the abruption in the placenta, or unhealthy placenta which is not supplying the adequate nutrients and the oxygen what is required for a fetus, this also can result in the retardation of growth in a fetus. And Coming to the fetal factors, so in case pregnancy is a multiple pregnancy, like a twin babies or a triplet pregnancies, or if the baby has a congenital anomaly or any the defect in developing organs like a cardiac or a renal or any major anomalies, these babies also can be SJ or growth retarded babies. And so these are all the factors which affects the growth of a fetus. So why do we need to worry about this entity? So what's the concern regarding the SGA? Because compared to the normal weight babies in appropriate for gestation age babies, these SGA babies, they have the higher mortality and morbidity complications than a normal appropriate for gestation age babies. Let's see how during the pregnancy, if the this entity is there, so there can be chances of more incidence of a preterm delivery, so which has its own set of complications. And for a mother, there can be more incidence of a cesarean birth than a normal delivery. And so during the delivery time, these babies, they may not withstand stress of a normal labor, so there can be brain hypoxia during the delivery time, which can result in a long term neurological bad outcome in the babies, and they can have a hypoxia and asphyxia. And also these babies, they may not establish a normal breathing at the time of birth. They may require a resuscitation at the time of birth. So and during this stress of delivery, these babies, they also can pass some motion because of intrauterine hypoxia, which is something called as a meconium. And they also can aspirate, which can aspirate into lungs. And post birth, these babies can have a respiratory distress, so which can lead to the incidents like NICU admission and the further respiratory care like oxygen, and in severe cases they may require a ventilation also. So these are all the complications babies can have during the this delivery time. And postnatally also, these SGA babies, they are high risk newborn babies. They have their own set of complications which are expected in these growth retarded babies. Like as soon as the baby born, so there can be chances of hypothermia, means because of less subcutaneous fat tissue, these babies may not be able to maintain a normal temperature, so which can leads to the hypothermia. And they can also have a hypoglycemia, which is low sugar level in a baby because of the less glucose reserve and glycogen stores in a baby. And they also can have these babies hypocalcemia because of less intrauterine transfer of calcium during the pregnancy time. And they also can have some entity called as a polycythemia. That means because of the chronic hypoxia in intrauterine period, these babies, as a compensation, they will produce more number of RBCs, which is also not good. As a result of this, polycythemia will happen, which can results in a decreased blood circulation, especially the vital organs. And some other complication also can occur with these. And these babies also can have the more neurological impairment compared to the normal for AGA babies. So these are all the complications SG and growth retarded babies can have during the delivery and post delivery. So coming to the management and prevention, how can we manage this and how can we prevent this entity? Good adequate healthcare of the pregnant women, which starts from preconceptional period only. Any undernutrition, malnutrition in any the reproductive age group mother has to be addressed properly before pregnancy. And any anemia also need to be addressed properly. And so all the pregnancies should be screened for high risk pregnancies like hypertension, diabetes, and other the infectious etiologies. And if at all, if these problems are there, has to be adequately managed. So all these things has to be done. So and how can during the pregnancy, so if the like any mother who found to have some SGR IUGR baby in scanning or during the pregnancy checkup, how do we manage? Okay, first thing is parental counseling has to be done. Like, oh, see, these are all the SGA babies and what needs to be taken care, and so no need to be panicky or worry. So it can be easily handled, and so the fetal well-being has to be monitored regularly and adequately during the pregnancy to avoid complications. Like regular ultrasound is needed to look for the one is a blood flow to the baby organs, that is that dopplers will be done just to see how is the blood flow to the fetus. So in case if any decreased or arrest of blood supply, so the immediate delivery is warranted in these cases. Like any arrest of the growth fetus also, the immediate delivery is indicated, and regularly the NST to be done for fetal well-being, and amniotic fluid assessment is also very important during this. And coming to the delivery, so this if any mother, if at all, because of any other forcing unexpected complication like any post intrauterine arrest of growth or any the decreased blood supply to the fetus, if any preterm delivery is expected, so there are glucocorticoids will be given, so just to accelerate the baby lung maturity. And the delivery also needs to be planned in the setup where there is a NICU and where there is a team of doctors who are specialized in taking care of these SGA babies. And also the team should be the ready to handle the complications during the birth time and the postnatal period also, since these babies often they require a NICU admission or the care in the specialized nursery. So that's how the babies should be managed. And what are the outcomes of these SGA babies on a long term this thing? So compared to the appropriate for gestation age babies, these babies they have a poor postnatal growth. Like after the birth also, their growth can be slowed down because of their the intrinsic factor it can be, or compared to the AJ babies, they will have a poor postnatal growth, and which needs to be handled with the high calorie and the adequate nutrition after the birth also. And these it has been shown that the adults who are born SG are low birth weight in at birth, so they also have a higher incidence of this coronary vascular diseases and so other metabolic disorder later in their life. These are all the and they also have a poor neurological outcome and impaired cognitive, so a little more percentage than the normal for appropriate for gestation age babies. So coming to the overall summary, so this SGA baby is a well-known entity, and which can be handled very easily by appropriate good antenatal care and good screening of the pregnant all pregnant mother for high risk pregnancies, and adequate treatment of a complication if at all any pregnant mother is having like a PH, diabetes or anemia. And the during the pregnancy the fetal well-being has to be monitored adequately so that the complications can be avoided. And the timely intervention for delivery is also very important, which decides the outcome of these babies. And this delivery also has to be planned in a center where there is an attached NICU or there is specialized nursery care. So since often these babies they require good postnatal care to handle the complications. So this is all the overall summary. So yes, it can the complication of these SCA babies can be easily prevented, treated with the adequate monitoring and treatment and appropriate intervention. So this is the message I wanted to give today. Thank you, everybody. Yes, okay, fine. Today there are no queries from audience, so I think this message is the enough for the parents or any pregnant mother just to know about this entity. Thank you all. Thank you.